Let's move to this now. Jack Bloom, the Gauteng Health Spokesperson, has echoed concerns that people in the province will be in for a rough time over the next few months. The province is still heading for the peak of the second wave of the COVID-19 pandemic. Now, two of the big concerns are the availability of beds and oxygen. Jack joins us. Jack Bloom, good afternoon and thanks for joining us on the program. Well, we've heard from Netcare Life Healthcare and Mediclinic who've denied turning away people from their facilities. But on another note, you've raised serious concerns that people of Gauteng will be in for a rough time over the next 2 months. Just talk us through what you anticipate to happen.
Well, if you can see where we are on the curve, we're going to follow the trajectory, unfortunately, of the coastal provinces, Western Cape, Eastern Cape, and KwaZulu-Natal. And we're really nowhere near the peak, unfortunately, if you see what per capita infections. I anticipate that the peak in Gauteng will be only in February. It might even only be in early March. You can see that Eastern Cape have peaked. Western Cape is starting to peak. KwaZulu-Natal is still going up. So we're going to be in for a very rough time. If I can compare the figures, at the height of the previous wave that we had in June, July last year, there were maximum 7,500 COVID-19 patients in both private and public hospitals. At the moment, we've got about 4,000 patients. So there still are beds if we look at from the previous experience, and there's supposed to be another 2,000 extra beds that have been built at public hospitals, but I think it's going to be rough, unfortunately.
Let's expand on that, the level of preparedness. Do you believe that healthcare centers and hospitals are properly equipped to treat more patients in a case where we see a surge in cases in the province?
Well, it's not just the beds. As I said, there have been extra beds at public hospitals. It's the staffing and equipment and oxygen. Oxygen is incredibly important. And what they found in the Western Cape is that they're using more than double the amount of oxygen than that they needed previously. My real concern is, do we have enough staff? That really is absolutely critical, because many staff, unfortunately, are becoming ill themselves. So that's making for short staffing. The vaccine is only going to come at the end of this month. So you can have the bed, but if you don't have the staff, it is not going to help much at all. And that's why I think we have private hospitals. It seems to be variable that whether they can accommodate or not at certain times. I do know that there are well-attested stories of people being turned away. They put patients on divert over a particularly heavy period, and that's of concern. The other thing that private hospitals are saying is that they might not be able to give you the full range of care. They can admit you and they'll do the best that they can, but you might not be able to be in an ICU bed and get all the treatment that you could have at another period. And this is already happening at KwaZulu-Natal. It happened in Eastern Cape. It's going down there, and it's happening in the Western Cape. So unfortunately, the surge is really starting to hit Gauteng badly. We've had 2 days now where there have been more than 6,000 cases. And I think you must understand that the tested cases are only a fraction of the real cases. The real number of cases could be anywhere between 4 to 10 times higher. So I really think we must do everything in our power to make sure that we do have sufficient staff, enough oxygen, and we do what we can to cope with what's unfortunately going to hit Gauteng.
Well, Mr. Bloom, unfortunately, we are running out of time. But before I let you go, I also want to touch on concerns that have been raised by healthcare workers in previous months over the issue of the adequate supply of quality PPEs. What have you noted on that front?
Well, I'm getting complaints that they don't have coveralls. That is an essential piece of equipment, so there's shortages of coveralls. And of course, there's always a question mark about the quality of PPE. I hope that this time round they get it right. I mean, it's just absolutely critical that our health workers who are on the front line, they put their lives on the line, are subject to unnecessary risk because they don't have proper PPE. So I hope that all supply problems are sorted out. There's really no excuse this time. We had enough time to prepare, and we must do what we can, and hopefully we get through this period as best we can.
Well, Mr. Bloom, thank you very much for your time. That was a DA Gauteng member of the legislature and spokesperson on health matters. That was Jack Bloom.